Dr. Bandile Masuku has just completed his first 100 days in office as Gauteng Health MEC. The department currently has 32 public hospitals, but at least 12 of these do not have permanent chief executive officers, not to mention the numerous problems faced by patients in these facilities and security concerns for nurses and doctors. Well, Bandile Masuku joins me to discuss the state of hospitals in the province. Good evening, Doc. Thank you very much for your time. Take us back to like 100 days when you took office. How would you describe the state of health care in Gauteng?
Good evening and thanks for having us. Your 100 days back, it was exactly a Thursday, and I think at this time I was at Mamelodi, dealing with the situation of an old lady who was tied up to a bench.
And this was your first day at work?
That was my first few hours at work. And I think that was also one of the signs that we are going to be responsive and active and be on the ground. And we faced a lot of problems. And the challenges that we have seen around our hospitals, they relate to bad patient experience. I think the example of the Mamelodi, actually summarizes that whole aspect. Also, our infrastructure is inadequate and it's becoming smaller and smaller, and some of them it's dilapidated and old and needs a bit of rework. And we had a lot of mental issues that relate to our staff workers. We have since discovered that our staff are actually having a very low morale. They are not motivated, hence the patient experience gets actually spoiled. So in summary, I think the problems of Gauteng Health can be summarized in basically the incident that happened in Mamelodi. Inadequate equipment to even do a basic restraining of a patient that has been violent or demented or something like that. So I think that's where our problems are, and we are very determined to resolve them.
I think everyone accepts that there is not sufficient money out there to actually do the things that should be done ideally. But also, on the same breath, there is an acceptance generally that a lot of the problems that lead to the bad patient experiences that you're talking about have to do with how the limited resources are in fact managed.
Yeah, I think you're actually spot on, because if you've got limited resources, we won't be able to have enough money or budget to even hire or employ enough staff. And part of it is that our staff are overworked and fatigued, and hence it leads to irritability. I think that's a usual response that you'll get from anyone who's overworked and fatigued. But I think that if we can utilize the resources that we have and go back to basics, use them efficiently, we could be able to cover the basics and make sure that our hospitals also functions at the level of hospitals, by making clinics, our 32 community health centers more functional, so that they'll be able to decongest and divert patients that don't really need to be in hospital to be fully treated in our clinics. And that's what our aim is. So we're looking at going back to basics, making sure that we use the little resources we have efficiently and get correct leaders, to lead the system. Hence, we are going to fill all the vacant posts, particularly the ones that are of CEOs of hospitals.
By when?
We have already shortlisted a number, I think around 18 of them, and we're going to interview them next week. And hopefully after the interviews, we'll announce immediately, because I think we won't take a lot of time and delay, to actually announce them. We need them on the ground to lead this upgrade and lead the improvement plans that we have put into place.
And I mean, it's not only these CEOs. You have a number of people who are facing all sorts of disciplinary processes. A lot of them are at home on full pay, and their disciplinary processes seem to be dragging on and on and on.
Yeah, it's a symptom of systems and hospitals that don't have leadership. Because some of the cases, when they're led from the institution, they can be easily done and dealt with at that level instead of them being upgraded to a head office case, a labor relation case in a province. So we are hoping that appointing the CEOs, they will be able to help us to deal with the backlogs, particularly also of the disciplinary processes, and also lead the improvement plans that we have in place.
And on the other hand, I mean, you have a lot of doctors and nurses who feel they are not protected, they are vulnerable to emergency services as well. These are people who say they are fine, they are prepared to work, and they show up, but they don't feel protected. They feel that their lives are in danger often unnecessarily when they could easily be protected.
Since I've taken office, I've actually said that our staff are actually the backbone of our health system. If without them, our health system would have collapsed long time ago. And we are very grateful and very thankful for the effort that they put in and day out, overworked and actually fatigued as they are. And one of the propositions that we have put into place, which will be linked to a reward system that we have, to even recognize those who do well and even reward them just being health workers in Gauteng. We are going to launch the program in a week's time, where we are going to explain to the public and also to them what the program will entail. But we are hopeful that the program, as it grows, it will be able to motivate them and make them a happier employee. But we are very grateful, and we pretty much understand the circumstances that they work under. And a lot of them complain that they're overworked because there's a shortage of staff, but not only staff, but as you know, equipment as well. Yeah, there are two priorities that I've actually made out and put out there that they are interrelated, and if we resolve them, I think the health system will be 50% better, actually moving forward. The one on patient experience, the other one on staff morale. But dealing with staff morale, motivating our health workers, our doctors, our nurses will definitely improve, patient experience. Giving them the tools of trade that they require will definitely improve treatment, and also the experience will be much shorter. And it will also reduce the waiting time of patients. But we are prepared. We've got 1.9 vacancy posts that we are going to advertise in the weekend papers. We are hopeful that we are going to be able to fill them by the end of October and November, and that will give us a better part of the workforce that we need. We are also talking to our treasury to create more posts in terms of funding, and to be able to have enough staff. And nationally, the national minister has also instructed us that any saving that happens in every other spaces, we need to put it into human resource so that we can be able to employ and equip, because employing doesn't mean that we must not equip them. We must equip them and also give them the tools of trade, including that basic things like uniform, where now you find our nurses struggle with uniform, which is unacceptable.
Now, have you dealt with the outstanding life esidimeni issues?
Pretty much so. What the Ombudsman has actually given us as what we need to do, we have done. He has actually advised us what we have to have a committee of an advisory team constituting of academics and researchers, which will advise the MEC on policy, on mental health, and they've actually produced a strategy on that space, on how we are going to approach it. The second part was to have review boards in all the districts. We've got 5 districts in Gauteng, which will be the one that will review the facilities that we house our mental health care users. So we are pretty much halfway there, and I think even in terms of the judgment from the retired Deputy Chief Justice, we have also done a bit. I think the government, the provincial government, through the Premier, will pronounce and actually finalize on what was the final thing about what we have done as government.
Yeah, that's where we're going to leave it for this evening. Thank you very much for coming through. Dr. Bandile Masuku, who is the Health MEC here in Gauteng.